Good morning, everyone. I just want to cover ABGs, arterial blood gases, and the two important acid-base balance that I want to cover is respiratory alkalolysis and respiratory acidosis. Okay, when it comes to ABGs, always link ABGs with what is happening to your patient. Okay, so for example, respiratory alkalolysis, it can happen to a patient when they are hyperventilating. Hyperventilating in the sense that they are breathing like really fast. Okay, so when a patient is breathing really fast, they're hyperventilating, and what is happening is that they are blowing off a lot of CO2. So when they blow off a lot of CO2, it makes their blood alkaline or basic. Okay, it makes so their blood alkaline or basic, so they've blown off all the CO2. Some common causes of respiratory alkalolysis will be anxiety, panic attack, or maybe a patient that's on a vent, and then the vent readings or the respiratory the breathing rate of the vents was not adjusted properly, or causing the patient to breathe, the vent is breathing faster for the patient, more than the patient can tolerate, something like that. So in a situation like that, so patients on vents can easily hyperventilate. I guess that's what I'm trying to say. So panic attack, anxious, anxiety, all of this can cause a patient to hyperventilate. When a patient is hyperventilating, they can go into a respiratory alkalolysis. Okay, so what will happen? What are some of the nursing consideration or nursing goals in a situation like this? When this happens, I want you to look at it like treating the underlying cause. Okay, so what is the cause of the respiratory alkalolysis? We want to treat that. Again, because I mentioned that during the hyperventilating state, the patient is blowing off a lot of CO2, making their blood more alkaline. Okay, so therefore CO2 levels will be low. Okay, CO2 levels will be low, pH will be high. Okay, so pH will be high, meaning that pH will be anything greater than 7.45. Normal pH is 7.35 to 7.45, but so anything greater than 7.45 for your pH, then of course your CO2 will be low. Okay, CO2 is 35 to 45, so your CO2 will be less than 35. So in that situation, your patient is in respiratory alkalolysis. Okay, there's also a method that is called the Rome method, which I should not bring it now. Yes, so respiratory alkalolysis. So again, treat the underlying cause. If it's being caused by fever, if it's caused by infection, if it's caused by panic attacks, hyperventilation, treat the underlying cause. Okay, if it's caused by pain, treat pain. Okay, so if it's pain that is causing your patient to hyperventilate, those will be patients that you want to give them pain medication, for example, like morphine. Morphine is a respiratory suppressant. It will slow down the respiratory rate, because if a patient is hyperventilating, their respiratory rate will be high, maybe in the 30s, in the 40s, and sometimes in the 50s. Okay, so in that situation, morphine for pain can help because it will slow down the respiratory rate and help them to breathe normally. And so that is respiratory alkalolysis. Then what about respiratory acidosis? Okay, for respiratory acidosis, now it will be directly opposite to respiratory alkalolysis. Okay, directly opposite to respiratory alkalolysis. So instead of the patient blowing off a lot of CO2, now they're building up CO2. Okay, so it's opposite. Patient cannot breathe. We see this in patients that dyspneic, like COPD, sleep apnea, drug overdose, yeah, yeah, especially our COPDs. Okay, so they're having difficulties breathing. They build up a lot of CO2. Okay, and because it's respiratory acidosis, it means that what will happen to the pH? The pH now will be less than 7.35. Okay, remember the pH for respiratory alkalolysis was greater than 7.35. Now the pH for, yeah, greater than 7.35, the pH for respiratory acidosis will be less than 7.35. Okay, no, let me take that back again. The pH for respiratory alkalolysis was greater than 7.45, because the normal pH is 7.35 to 7.45. So alkalolysis is pH is greater than 7.45. Now for respiratory acidosis, because they're building up CO2, their CO2 level will be high, number one, and then number two, their pH will be low. Okay, their pH will be low, so less than 7.35. So they are in an acidotic state. So again, treat the underlying cause. So whether it's respiratory acidosis or respiratory alkalolysis, we want to treat what is causing it. If for respiratory acidosis, if it's being caused by COPD, then of course we want to open up that airway. Sometimes it will be the treatment if it's caused by hypoxemia, so there's not enough oxygen in the blood, then we want to give them, supplement them with oxygen, right? Sometimes medications like bronchodilators, you want to open up their airways for them to be able to breathe easily. Okay, so again, just this is a brief to help you. You have to know this. You have to know this for your exams. Okay, you have to know this for your exams for NCLEX. The respiratory acidosis and respiratory alkalolysis. Okay, you can also use the Rome method. Some people find the Rome method easy, so look up the Rome method, which it just says that if an issue is a respiratory issue, then it's opposite. Respiratory Rome, R for respiratory, O for opposite, M for metabolic, and E for equal. So if it's a metabolic situation, then equal. So when we say respiratory opposite, that means that the pH, if the pH and the CO2 will be opposite to each other. So if the pH is high, the CO2 will be low. If the pH is low, the CO2 will be high. So opposite, that's what it means. Okay, so this was just a brief summary. Whenever I want you to always link ABGs to what is happening to your patient, and especially for respiratory issues. Okay, respiratory issues, that means that you're looking at your CO2. Okay, so you start with what is the normal CO2. Is the patient, is it high or is it low? Then you look at your pH. What is happening to the pH? Is my patient is in an acidotic state, or in an alkali state, or in a basic state or alkali state? So that will be able to help you to read your ABGs, interpret your ABGs, and address your patient's situations easily. So again, what is happening to the patient? You want to treat the root cause or the underlying cause for the respiratory issue. Okay, I'll stop here.